All right, we're back at another episode of the Dreamers podcast. The first one was pretty decent.
Pretty good, I would say.
We had a great conversation with Dr. Glenn, and it was nice to get to know more about him, not just at a doctor's level, but at a personal level.
And honestly, thank you to the audience as well. I feel like y'all helped out a lot supporting us and just, giving us good advice for the future podcast.
Agreed. And today we're back at another podcast of the Dreamers with an exceptional doctor. So we're going to be trying to bring in medical professionals every month. We're back in a month again, and we're going to try to keep it this way. So please help us out, like, subscribe, share. And my name is Asfan Musa. I'm a co-host of the Dreamers podcast. And
I'm Mani Rahman, and also a co-host of the Dreamers podcast. Let's get started.
Dreamers podcast is where we bring in the professionals who fight against their adversity and have a purpose that they're fighting towards. Today's guest,
Dr. Reitzel, welcome to the Dreamers podcast.
Thank you.
Let me go ahead and introduce Dr. Reitzel. I wrote a little paragraph for you, so I'm going to go ahead and read that off. So Dr. Lorraine Reitzel is a professor of behavioral science at the University of Texas MD Anderson Cancer Center. Her groundbreaking research focuses on the social determinants of cancer and cancer-related risk behaviors like tobacco use, physical inactivity, and substance use, particularly among the marginalized communities, underserved communities. She leads work that doesn't just stay in the lab, but transforms policy and real-world practice.
And again, our personal story is just as powerful. As a cancer survivor herself, Dr. Reitzel once walked the halls of MD Anderson herself, and she's now a respected researcher and a lab leader. She's driven by purpose, fueled by her family's struggles with tobacco, and by her own journey.
She's helped secure over millions of dollars in research funding and has been an author for 200 or more, or probably more than 200 peer-reviewed articles at this point, and which is amazing. She's also part of American Academy of Health Behavior and the Society for Research on Nicotine and Tobacco.
Dr. Reitzel, welcome to Dreamers.
Thank you. Thank you so much.
Your journey from a cancer survivor to a professor. So you were a cancer survivor at MD Anderson. You went as a patient at MD Anderson, and then look at you now. I mean, you're a professor at MD Anderson Cancer Center. It's the #1 cancer facility in the nation. So what was that journey like? What was the whole experience from being a patient at MD Anderson to being a professor up there?
Well, actually, when I was actually working at MD Anderson when I was diagnosed with cancer.
Oh, wow.
Yeah, I was a postdoctoral fellow, so a trainee at the organization at that time, back in 2007. And I was just kind of working. I think I was working a couple of jobs at the time. Like, it was a lot, trying to start my career and make ends meet and that sort of thing. And then I just developed when I swallowed, there was like a lump in my throat and I could feel it kind of going up and down on the side. And then went and had a fine needle biopsy and they told me that I had papillary thyroid cancer. And I've actually found out while I was at work. I was at my desk working and my boss rounded the corner and walked in and my face just must have been white. And he was going to ask me about some paper we were working on. And I was just like, I have cancer. And he was didn't know what to do,
Yeah.
But in some ways, it was a blessing, obviously, working at this cancer hospital and being diagnosed. My boss just called up somebody that he knew in endocrinology. And I was talking to that wonderful surgeon within probably 2 hours. That's not the experience that most people would likely have, right? That's an experience of privilege for having known people there. But MD Anderson was just a wonderful place to get care. And it was a little weird at first, obviously, being a patient and working there. But I knew how to get around. So that was one of the benefits, because MD Anderson is huge. So because I had worked there before, I knew how to get everywhere. Yeah.
So did that motivate you, your experience of being a patient and having being treated so nicely at MD Anderson? Did that motivate you to go back and work for them again? Once you have made it as a doctor, you earned your PhD in clinical psychology.
Yeah.
So was that a motivation why you wanted to go back? Because I know you started your lab at University of Houston.
Yes.
Go Cougs. So when you got the opportunity to transfer from UH to MD Anderson, how was that experience? What did you think?
Yeah, it was nice because I was familiar with it. But I mean, MD Anderson is just a really special place, especially for people diagnosed with cancer. And They even, when you start working there, they talk about the importance of when you're walking down the hallway, just kind of like being friendly and smiling and helping people. So it's just like I just think it's a really special place to be. And I think that extends to work too, because the people around you are just really nice, good, caring, collegial people.
Did surviving cancer change the way you approach health equities or treating health equities and also training the future physician scientists?
Yeah, that's a great question. I definitely have always been open about being a cancer survivor. And I think for me, it makes doing cancer prevention research particularly meaningful, right? Because I know what it's like to experience cancer. And in some ways, I guess it's a little bit of credibility, which sounds funny, but like a little bit of credibility as well when you're working with people to prevent cancer, being a survivor yourself.
Great.
Yeah. Trying to think if there's anything else I wanted to elaborate on about that, but I don't remember. I'm sorry.
No worries.
Okay, thanks.
And what was your journey like from going from undergraduate to getting your PhD in clinical psychology? Like, could you walk us through the whole journey?
Yeah, sure. So I was the first gen, the first in my family to get a bachelor's degree.
Wow.
Yeah.
That's
and
amazing.
So I didn't know what I was doing, I didn't know but I always liked psychology. I thought it was very interesting. There's lots of good TV shows about that. And actually, I always wanted to be a correctional psychologist in prisons. And so that's what I did my entire career. I got a bachelor's, wanted to do that in psychology, went directly, got a master's degree, during which I worked in a prison. And then after that, I decided to go back for my PhD, did that, worked in different correctional settings. And then my capstone, my internship was actually at a federal prison. It's like, wow, I finally am exactly where I wanted to be, and it wasn't where I wanted to be, strangely. I guess that's life, right?
It's life.
Yeah, it kind of makes sense when you look back at it, but it wasn't always the path that I had planned on.
Yeah.
But I discovered, I think being first gen, and just really being excited about the opportunity to go to college and being away from home, I asked a lot of questions because I didn't know. And in doing that, I think I inadvertently opened a lot of doors. I tried to say no to nothing. I tried to take advantage of everything, but do the best I could at every opportunity that was in front of me. And so that gave me experience with research, even though I was like, nah, I don't want to do that. I want to be a talk therapist. I don't want to do that research stuff. But suddenly I was getting this under my belt. And then when I was done with my PhD, I was like, okay, so I don't want to work in prisons. What am I going to do?
Yeah.
And so then I relied on all the skills that I had gotten by just being open and keeping doors open. And that defined kind of the rest of my career.
Very inspiring.
Yeah.
And that's literally the reason why we decided to open this podcast channel, is because a lot of our viewers, they're like first-gen students trying to get into their careers. They're just starting their journeys. And including us, we were both like first-gen pre-health students, and nobody in our families did that. So we want to go ahead and pursue this career, and we know the struggles, how hard it is. And like you said, you just have to approach everyone and anyone, and you have to ask, and the worst they can say is no, right?
Exactly.
So if they say no, it's fine. You move on.
Yes.
But what if they say yes? It may work out for you. So.
And it may define the rest of your life. You just never know. Yeah.
And also the fact that you weren't even trying to do research, but it just fell in like that, right? So again, it's unexpected. Your career, it can go any way you want. But
it really can. At any point in time. You think by the time you get done with your PhD, you know what you're doing.
Exactly.
No, not so much. But yeah.
All right, you did a career in studying tobacco, and I read an article that you had a deep connection with your family history as well with tobacco.
Yes.
Can you kind of talk about your experiences with that and what drove you? I guess that kind of drove you towards research.
Well, it's interesting. My parents were older, so my father was in World War II, and back in World War II, they would hand out cigarettes in the army, right? And so he was a smoker. He actually successfully stopped smoking before I was born. But my mother, from the time she was probably, I think, 15 or 16, smoked. And she just had a very, very deep and strong addiction, which, sometimes women can tend to get more addicted to nicotine sometimes than men and have a different pattern. And she tried to shake it so much. And I remember when I was growing up, she would try different things that maybe weren't empirically or scientifically supported, like hypnosis or other things like that. And she was just never able to break that addiction. And I watched that happen. And she smoked in our home. And so I didn't realize until I went off to college and would come back for spring break or whatever. Oh, all my stuff smelled. I never realized that growing up because I grew up in a smoke-filled home, And it's just, I think as I kind of happened into I was always interested in substance abuse, but I happened into a career in tobacco. It was kind of like, it was an opportunity. My passion was always more about health equity, having worked in correctional settings with, health equity populations. And so I had the opportunity to go to MD Anderson as a postdoctoral fellow doing work in health disparities research, and it happened to be around tobacco. And I was like, people still smoke? As it turns out, they do. And some groups tend to have very high smoking rates because they're not getting treated, or they don't have the same opportunities to treatment as do other groups. And then I realized, kind of in my re-education or re-specialization into tobacco prevention, tobacco use prevention, that it's really a social justice issue, because the tobacco marketers are targeting certain populations, certain people, to addict them to tobacco. And ultimately, tobacco leads to probably the broadest range of diseases, including cancers, but all kinds of chronic diseases and that sort of thing as well. And so it seemed like a good, I wasn't able to do anything to help my mom, right? But in retrospect, it's great that I'm able to do things to help other people who maybe were like my mom.
Yeah. That's amazing.
Yeah, honestly, you answered my other question already, but people that say like quitting tobacco is all about, or tobacco and nicotine is all about just willpower.
Yeah,
what do you think about that, like specifically?
I think it's not true. I know it's not true. I mean, tobacco is nicotine in particular, the addictive component of tobacco. It is one of the most powerful addictive drugs you can imagine. And if you think about it if you think about like, okay, someone who's an alcoholic, how often do they have a drink? Well, maybe they'll drink in the afternoon or the evenings. Maybe it'll be like 6 or more. Fine. A cigarette, people who smoke a cigarette and are really addicted to nicotine, it's like dosing every hour for the entire day, from the time you wake up until the time you go to bed. And I mean, when you have to dose yourself that much to feel like you're not anxious or you're not in withdrawal, I mean, I think that speaks to how addictive it is. And, smoking, the tobacco industry too, it evolves. When policies and rules and guidelines evolve, right? And so now you're not allowed to smoke in many places, but the tobacco industry has now created a lot of other products to allow people to continue their addiction to nicotine as well, that are allowed in these spaces. And they kind of always keep ahead of public health in some ways. And so that's why I say it's a social justice issue, because most of the people who smoke now are lower income, just populations that are already burdened by a lot of intersectional types of challenges and stresses.
I feel like the corporations have a big control over that, especially too.
They do. Yeah, they absolutely do. That and politics too.
Yeah.
Agreed. Yeah. A lot of people I know, they're like, they tell me that they smoke. The reasons why they smoke is because of stress. So every time they get stressed, they have to smoke a cigarette. And I know people who are smoking like 2 packs a day, which is pretty bad if you look at it that way. Yeah,
absolutely. Very bad, definitely.
With vaping and e-cigarettes being so common among the youth now, especially, what does your research say about that, about the dangers or misconceptions about these products? So all the e-cigarettes, anything related to like e-cigarettes, what do you think? What is research being? I know there's not a lot of research out already. Yeah. So we can't say much about it, but what do you think personally? Is it the better option compared to cigarettes?
My goodness. Yeah, I think it's still kind of a debate even in our field about that. And I mostly work with adults, mostly work with traditional, conventional tobacco, cigarette smokers and that sort of thing. But I think there's a few ways to look at the e-cigarette vaping kind of thing. Number one, the tobacco companies, it's kind of like their old playbook in terms of creating things that are flavored in ways that might attract children, like bubble gum, right? Yeah. Like, are adults really? I mean, maybe some, but, it's clearly a kid's flavor type of thing. And that's the products that they started with in terms of vaping. And if we're talking about getting a whole new generation hooked on nicotine, then vaping in those flavors can't be a good thing, right? Yeah. So, and even with vapes, with Juul, when that started out, it was the equivalent of like a pack of cigarettes a day, 1 Juul pod, which, even when people started conventional cigarette smoking before they knew how bad it was for you, kids didn't start with a pack a day, we don't know yet really what kind of damage that might do to somebody because it took us, 25, 50 years to figure out what smoking did as far as long-term damage. So it's bad if it hooks kids. I mean, I think everybody's pretty much on the same page about that.
Yeah.
I think in my field, though, that there's some controversy that is vaping as bad as conventional cigarette smoking? And the answer to that might be no, it's not as bad because it doesn't have a lot of the things that are in a traditional cigarette, you know, the arsenic, this, the that. So if you can get someone to switch from conventional cigarette smoking to vaping without developing a stronger nicotine addiction, or potentially without then feeling like they need to use both products, which could be an issue if you're getting yourself even more addicted to nicotine, in terms of if you're trying to quit smoking. But if you can switch, it may be better for you in the long term. But what we say is, you know, to folks, it's like e-cigarettes are not an FDA approved way of quitting tobacco.
Yeah, sure.
And there are FDA ways of quitting smoking and tobacco use. And so me as a public health professional, I feel like I have to say, you know, we know these things work. There's been so much research about these things, like Chantix or Wellbutrin specifically is a very effective drug. Dual forms of nicotine replacement therapy. Those are also really effective ways to quit smoking in combination with talk therapy or, you know, like just kind of support, whether it's through a one-on-one, you know, therapist or whether it's through the quit line, just like some kind of counseling to help you get through it. And there's no shame in that, as far as I'm concerned. And if you're able to quit smoking or tobacco use at any age, it will be beneficial. It will be beneficial for your body. There is no age at which stopping doesn't yield fruit in terms of health.
Wonderful. And the reason you say smoking could be worse than e-cigarettes or e-products, is that because of like the burning chemicals?
It's the burning. You're exactly right. Yeah, it's the fire with those chemicals that you're inhaling into your lungs. And so that's why I think some of the newer products they say are supposed to be safer because they're heat, maybe not burn, that sort of thing. But again, you know, more research is needed and the field is a little divided on it. Yeah. But I think at the end of the day, all of us in public health, we just want people to, you know, do the best thing for their health. And it doesn't seem, you know, I don't like to say that it's not willpower in terms of quitting. This is a matter of this product that you wanted to try that suddenly got you hooked that now you can't get away from without experiencing a lot of withdrawal and negative symptoms. And so how can we help people do that?
So with smokers, the thing is, a lot of smokers do try quitting.
Yes, they do.
But then they relapse.
They do, yeah.
So what is it that makes it so hard for them to quit? And what's some ways that quitting can be, or a good way to quit, that you can quit for good, for sure? What are some ways that you would suggest to people watching the podcast? Yeah,
definitely use some sort of scientifically supported medication and talk therapy or counseling. That's the way to do it. And I think, you know, not only this frequent dosing that makes it really hard, nicotine addiction is considered to be a chronic you know, thing, even if you're not currently smoking, right? Kind of like how they, you know, with Alcoholics Anonymous, they say, you know, you always have the potential to relapse. It's kind of the same thinking about it being a chronic disease, nicotine addiction over time. And I think it's one of those things because it's pervasive in a person's life. It's what you do when you get up in the morning. It's what you have with your first cup of coffee. You know, it's just become part of your everyday and almost every part of your everyday.
It's like a routine kind of
thing.
Yeah,
absolutely. And so, you know, you have to learn a whole new way of living. And that's why I think it's, aside from the addiction piece, there's the habitual piece of it being such a strong part of your life. And so, it is hard. And it's hard to quit for those two reasons. People can try 9 times to do it, even more sometimes until they're successful. But what we say is, you know, keep trying, because it's really hard to do. And each time, even if you're not successful at quitting or staying quit for a long time, you're learning something about what did work for you. And so in talk therapy, those are the things that we try to talk about. And sometimes it means you kind of avoid some of the things that you used to do, like if you used to go to a bar and have a drink and smoke and they're really intertwined, you know, maybe you don't do that for a little bit, just to kind of break those habits. And you always have to watch yourself, and you have to watch yourself during, you know, stressful times or even happy times when you get together with your family or other smokers when you would normally quit. So it's really a life-changing thing to quit, but there's nothing better that you can do for your health.
Wonderful. Yeah, and also like I feel like vaping essentially is so accessible now to everyone.
It is.
I've seen a couple people who switch from vapes to cigarettes, which is also like a very bad thing. Is like how you going from something like, you're starting off as vapes that's accessible to youth, and then you go on to cigarettes, which is like, worse.
Yeah. Exactly.
So I really don't get that part. But again, to our audience, quit vaping, stop smoking, like it's important. Yeah.
Definitely. And there is treatment out there to do it, and it's accessible and it's often free. There's a quit line. There are apps now. There's a bunch of really scientifically supported ways to quit.
Yeah,
wonderful. And you work with specific groups, and those groups being like homelessness, people experiencing behavioral health conditions,
absolutely,
as well as like people in recovery. So
absolutely, how
do we support groups specifically like that? What makes it so hard for them, and then how can we support as individuals?
Yeah. Those are the groups, some of the ones that you named, those are where we see disproportionately high tobacco use and smoking among them. And I think there's a lot of mental health disorders. There can be what is perceived as beneficial properties of smoking. Sometimes, like, it helps to with alertness or to keep thoughts organized. But I think the important thing to remember there is that, so there are also medications for mental health symptoms and disorders that can do the same thing, and they're not damaging your lungs every day. But yeah, I think what you can do is, some of the stuff that we do is we go out and try to educate people. We go into mental health treatment centers, behavioral health treatment centers, recovery settings, support places for individuals experiencing homelessness. And we try to educate both the people that work there so that they can educate the people that receive trusted care at those organizations. And then they can help be steered to resources they may not have known about. Even when we work with experienced professionals at behavioral health treatment centers, 45% of them have never even heard of the Quit Line, which is a national resource that anybody can use. And so if they don't even know about it, they're not telling their patients about it. And one thing we know about patients, even if they have like a very, very strong addiction, is that at some point, they want to quit for some reason, whether it's because it makes their clothes smell, whether it's because they don't have a lot of money and the money that they're spending on cigarettes, whether it's they feel like they can't do it like they can't go into places while they're smoking cigarettes. And so they have to stand out in the cold and stand out in the rain. People want to quit. Almost everybody wants to quit. They just may not want to quit 24/7, and it's hard to quit, right? Yeah. So it's kind of like capturing them at a time when their motivation to quit is high. And then there's also different strategies that you can use to really develop or really harness a person's internal motivation to quit. Really talking with them about, why might you want to quit? And getting them to really voice those things and think more about those things can really get somebody willing to make a quit attempt. And so I think there are lots of things that we can do. I think it's just not happening with some groups in the population because other problems may be considered maybe more important in these treatment facilities. And I'm not saying that they're not. I'm just saying that oftentimes these folks, what they're going to die from is their tobacco addiction, whether it's being treated or not. So seems like an important thing.
And that's what your lab is doing, basically. You guys are going out there in the community, educating people, trying to provide the resources. Because a lot of people, like you said, they want to quit, but they just don't have the right resources.
No, they don't. Yeah, so they don't know about it.
What you're doing is amazing.
Oh, thank you.
Very inspiring.
Thank you.
And kind of moving on from that is like a couple of programs that you're a part of is Taking Texas Tobacco Free,
that's right,
Health Fast, and Stronger Scholar program.
Yeah.
Can you tell about like these projects and how they're helping the community?
Sure, definitely. So I have kind of these two areas of my research. One is tobacco health equity. The other one is working with trainees, from undergrad all the way. I've even worked with high school students, but undergrad all the way through to like early stage professionals. And so I've talked a lot about kind of the tobacco stuff, so I'll fill you in a little bit about the other stuff. I've always felt like because, I feel like I lucked into situations in terms of how I've gotten to where I've gotten to in career. And it's been a lot. I've worked with a lot of wonderful people who have given me opportunities that I otherwise never would have had. And so that's why I really enjoy working closely with students and showing them kind of like, oh, no, you can do this too. You totally can, because somebody once did that for me. And so I have the privilege of being funded by the National Institutes of Health, National Institutes of Drug Abuse, to be able to fund scholars of different levels to work with me or fund their initial research ideas so that they can start to get their feet under them and get, getting their way to 200 publications and millions of dollars in grant funding too. And, just kind of benefit from the experience of others who have kind of gone down that path. Yeah. I had people helping me. I want to help people too. And oftentimes you kind of need help in order to understand something, especially if you're first gen and you don't have people, or your family wasn't doing that kind of work and you don't know about it. So you need somebody that's kind of on your side. It's kind of invaluable to give you those opportunities. And I feel privileged to be able to do that with students. And oftentimes when we work with students, we have those students go out in the community, right? So this is where the training programs kind of connect to the tobacco work that I do. The work that I do is in the community, in these settings where people are smoking a lot. And so my students get to go into those settings, interview the providers, learn more about what's going on there, help them with their policies to be tobacco, to have their entire workplace be tobacco and vape free, help them with their interventions. We have students sit in when we train professionals on how to treat tobacco use, when we train professionals on motivational interviewing, how to motivate a tobacco quit attempt. And so they get to learn alongside, and they also get to meet and see all these different career paths that they could go down with their degrees too. And so that's kind of how it all comes together.
Before we wrap this up, we want to ask you a couple of questions that our viewers on social media asked us to ask you.
Yeah, the first one was, with the widespread use of Zyn, how would you consider them a better alternative to other nicotine products, such as like nicotine gum and pouches? Are there any potential downsides to these products?
Well, for sure. I mean, you never can trust the tobacco company. Yeah. They're not giving you, health foods and vitamins. Yeah. So with regard to Zyn or anything that you put into your mouth, I mean, your mouth is pretty sensitive. So is your throat. Like, those are some pretty sensitive skin there. And, I've seen in the past when people used to use spit tobacco that they would end up with, head, throat cancers as a result of having that kind of in their mouths. And I don't know that Zyn is necessarily much better than those things. I think just generally speaking, don't start using tobacco products and don't put them there, because there's been facial disfigurement and that sort of thing, like when people have used tobacco and held it in their mouth for long periods of time.
Again, there's no pros, or always cons. I feel like that's like a big thing. There's like no pros to using these products.
No, definitely not. Yeah.
And another question that the social media asked, which part of you already, you have already answered part of the question, but it's basically a lot of our viewers are undergraduate students.
Yes.
And they're just starting this journey. They need some sort of guidance. They're struggling at the moment with finding the resources as well as the right guidance. And they're afraid of emailing doctors and asking for help. But as an upperclassman, I would give them the same suggestion as that's what I did with all the connections that I've made with all these doctors, is I started reaching out to them. And it does not hurt to ask. The worst they can say is no or ignore you, but it's fine. You move on to the next one and you just keep asking until one of them says yes. So what would you say something about that?
Yeah, definitely. So I guess, the on the other side of that is don't take on too much as a student. That can be bad, because whatever opportunities that you get, you want to do them very, very well. So be careful of being over committed to things. Make sure whatever you take it on and do it well. But I think the other side of that is that you have to also be willing to be criticized. That's hard for folks. And I mean, constructive criticism, of course. But, that's part of learning. And so you have to be willing to take feedback. Sometimes you have to be willing to have somebody not answer your email and not be deterred, right? Because other people are busy and that sort of thing too. But like you said, keep trying, and someone is going to say yes at some point in time, and then you never know where that will take you.
Amazing advice. And Dr. Reitzel, this has been an amazing podcast. Thank you so much for coming in. It was truly an honor. The work you're doing is very inspiring, and I'm pretty sure all the viewers that are watching this podcast, they're going to be truly inspired by the work you have done so far.
Thank you.
And where can people keep up? One last question. Where can people keep up with your work that you're doing, or also like overall with the tobacco research? Keep being updated of like whatever the work is going on at the moment. What can people do to follow
Sure.
up?
Yeah, definitely. I think different advocacy organizations in the community, they just have really great ways of conveying information in terms that are very understandable. Places like the Truth Initiative, for example, if you've ever seen their website, American Lung Association, others like that. The CDC, they always have stuff about tobacco. So it's really easy to find out about the harms of tobacco if you just Google it. Yeah. And so that would be what I would advise for that. And make sure, it's a legitimate governmental site versus something that, Philip Reynolds might put together. And as far as for me, you could Google me, Lorraine Reitzel. I'm the only one out there that I'm aware of with that name. And my website where we have our tobacco equity work, it's called www.takingtexastobaccofree.com.
Wonderful. And yeah, she is pretty famous. You Google her, you're going to see a bunch of things about her on like the net. So that's what we did. We just Googled her name and we found a bunch of articles, a bunch of newses. So yeah, that's been amazing.
And again, thank you so much, Dr. Reitzel. I feel like you coming on was a big opportunity for us to kind of talk about tobacco research and the negatives of it. Yeah. And again, if you like this episode, subscribe, share, like, and if you were inspired by her story, keep tuning in. We have a lot more coming in soon. And again, thank you so much.
Absolutely.
This has been amazing.
Thank you.
Thank you.